All right, we are super pleased to be here today with Dr. Stephen Lawenda. Dr. Lawenda is a board-certified family medicine physician at Kaiser Permanente in Southern California. Uh, like many physicians, Dr. Lawenda did not study nutrition during his medical training. And he actually personally struggled with obesity and a lot of the same chronic diseases that his patients were experiencing. So disappointing that he wasn't a very good example for his patients, Dr. Lawenda fortunately discovered the power of plant-based nutrition. So he adopted a whole food plant-based diet and has successfully transformed his own health and has subsequently inspired many of his patients to follow in his suit. So Dr. Lawenda co-founded and co-led a program called Life 180 to educate, guide, and support high-risk patients in making the transition to a plant-based diet to reverse chronic disease and reduce their medication usage by up to 80% for conditions like diabetes and hypertension. Dr. Lawenda also created a new popular 2-hour plant-based diet introductory class at Kaiser Permanente, and it's called Plants for Life. So for his work, Kaiser Permanente has recently recognized Dr. Lawenda as an everyday hero. So thank you so much for being here with us today, Dr. Lawenda.
Thank you both. It's such an honor.
You have a very inspiring story. And, I gave a little tip of the iceberg here. So can you give our listeners some introduction into who you are and what got you into plant-based nutrition in the first place?
Sure. So, growing up, I witnessed my father go through so many horrible medical conditions, heart attack, diabetes. My father's been through just about every complication of diabetes, including he about 7 years ago had to lose both of his legs. He had both of his legs amputated from diabetes. So I've seen the absolute worst things happen to my own father, and I was worried that I was going to follow in his footsteps. And I was struggling with obesity. We never learned how to eat growing up, or at least I didn't realize it at the time. And it turns out my father actually grew up in a business. The family business was a bakery growing up, so that he loved baked goods and obviously you grow up in a bakery business, you don't really learn much about nutrition there either. And then my mother actually, her family owned a mom and pop fast food business, fast food restaurant. So anyway, long story short, I struggled with obesity and I yo-yoed up and down. The only thing I knew, which I think most of our patients and most doctors know, is portion control and exercise. And I would be able to lose weight for a couple months and then I'd put it right back on. And I got so frustrated, so disappointed in myself. I blamed myself. I thought, well, gee, I must be weak. I must have no willpower. I must not be strong. And I was getting depressed about this. And I was worried that I was going to have a heart attack because my father had one at 45 and his father had one at 38. And my wife and I were starting a family. We had 2 small girls, beautiful girls, and I was panicking because I knew that with heart attacks, most of the time there's no warning, and 1 out of 3 heart attacks, people die. So not to mention the fact that diabetes is an awful, awful disease, of course. So long story short, it was by accident that I discovered the power of plant-based nutrition. My wife is a little bit more extroverted than I am, and she was chatting with some friends and family, and they recommended Dr. Furman's book, Eat to Live. And my wife happened to be playing it in the car one day. And I just happened to be listening to it just by accident. And in fact, to be honest, I didn't really even, wasn't in the mood to listen to an audiobook at the time. We were coming home from a trip and I just wanted to relax, listen to music because I had work the next day and just kind of unwind in the car. And anyway, long story short, it was on. And but what I was hearing was absolutely blowing my mind, that you could eat as much as you want and still lose weight. Not only lose weight, but reverse disease. And I've never heard anyone say where the more you eat of whole plant foods, especially greens, the more greens you eat, the more weight you lose, was what Dr. Furman said. And I thought about it and it made a lot of sense, but I just never thought about it before. So all of a sudden my mind started opening up and I started to realize, oh my goodness, maybe there is a much better way than portion control and exercise. And not only is there a way to lose weight and keep it off forever, but there's a way to actually reverse disease. And it's looking back, I'm a bit frustrated as it doesn't do justice to to the fact that, how I feel about the fact that I wasn't taught about this. But nonetheless, I learned about it and I challenged myself to eat this way. I said, you know what, I can do it for 6 weeks or a couple months. I'll just challenge myself. And I did so. And it was tough in the beginning, making this change, just like quitting smoking. I mean, I didn't smoke, but I mean, how smokers quit, how alcoholics quit. But making a change, you don't realize how addicted you are to processed foods and so forth and animal foods until you make the change. Nonetheless, I lost the first 8 months, I lost 75 pounds. I had pre-diabetes. Yeah. I had pre-diabetes, got rid of that. My blood pressure dropped 20 points. I had acid reflux every single day and that went away. I had family tell me that I definitely had sleep apnea, though I wasn't tested. But that officially, I finally got tested after I lost all the weight, which in hindsight, maybe I should have been tested earlier, but I don't have sleep apnea. So I'm a transformed person. And since the first 8 months, I've actually lost an additional 15 pounds. So now I'm down 90 pounds. And it's been about 5 years now. So, I've never kept off weight for 5 years. And in fact, like I said, I've lost more, and I've lost more because I've just learned, some more tips and tricks along the way. And I'm teaching this to my patients. So I figure I'll practice what I preach, of course. Got to walk the walk. So then I started to realize, gosh, this is real. This is real. This is amazing. This is the best medicine we have. This is the best way to eat. It makes so much sense. Why doesn't everybody know about this? Why don't my colleagues know about this? My patients know about this. So I've been on a mission ever since, and I haven't looked back. And the more I do this, the more passionate I become, because the more I've seen some amazing transformations in patients. I've seen, and the thing is too, is that, and you guys know this, but this way of eating or living, you're not only fixing one condition, but in terms of the health benefits, the benefits are across the board, of course. I mean, we know this. I'm preaching to the choir, but perhaps your audience, there may be some who are new to this. So, as a doctor, if I prescribe a blood pressure pill, that doesn't lower blood sugar. That doesn't lower your cholesterol. That doesn't help you lose weight. That doesn't reverse your heart disease. And the other thing too is that when you eat this way, the side effects are good ones. There's virtually no risk. It's super low cost. And the other thing too is that I didn't realize this at the time, but it makes sense. The benefits of this are actually contagious. In other words, if I give you a blood pressure pill, your family's blood pressure doesn't go down. But if you start eating this way and your family starts eating this way, everybody's blood pressure goes down. Everybody's sugar goes down. Everybody's cholesterol goes down. Everybody has more energy. Everybody is feeling better. So there's just nothing that comes close to what this does. And so I know if I'm guilty of anything, I'm obsessed. I have a new addiction, and it's this. And I honestly live it, I breathe it, and it's I don't know what else to say, really. I mean, it's just the most powerful thing I've seen, and I can't wait to share some of the stories I've seen with some of my patients with you guys and the audience. So
yeah.
Anyway,
this is amazing. It never gets old hearing your story. I remember when I was working at Forks Over Knives and we published your story on the website. We were just so excited about this. Look at this guy. He's such an example, and he's a physician. This is awesome. So we'd like to hear a little more about how do you incorporate this transformation you've gone on for yourself into your practice?
Sure. So, the first thing I realized that teaching one patient at a time, an entire class during a short office visit is just not going to work. And so what I realized is this has to be done in a group-like setting in order to reach as many patients as possible. So, and I realized too that a lot of patients, one class is not necessarily enough for a lot of people. They need ongoing support. So I thought of, and there was a nurse practitioner who I work with who she became very passionate about this as well. And she and I decided, her name is Maureen Woodson, she and I decided to start a support group that's sort of half class, or sort of education and support group rolled into one. And so we called that Life 180 because we had the idea that these patients' lives would be turned around 180 degrees. And so that's a 3-month program. And we meet once a week for a couple hours, and we share some food and some recipes, and we have a little bit of education at the beginning, and then the remainder of the session is a support group. And it's been very successful. There's a little bit of online support with that as well. And then the other thing I realized is that, unfortunately, this support group is small. So then what ended up happening was that the results were so amazing with some of these patients that word of mouth started to spread. And then before we knew it, we had a huge wait list of people who wanted to get in this program, and we couldn't accommodate them all. So we figured, well, the only thing we could really do to sort of help with these patients who were becoming angry that they couldn't get in, which is a good problem to have, is that we would start a one-time 2-hour class, realizing that they wouldn't have the support group component, but at least they get the education. And then if we could kind of show that there's a great demand, then we can maybe expand these support groups, which we're looking at doing that soon. It's just, sometimes change is a little slow, and I'm a full-time doctor, so expanding these programs is not so easy. And there's a shortage of primary care doctors in the country. So, they need me on the front lines, but I've been told that we're going to be able to support this, expand it. So, in the class that we offer too, just real quick, it's exciting because this class, we're seeing about 200 to 250 new patients every month getting educated on a plant-based diet. And we're not even promoting it necessarily. They know it's a plant-based diet class, but we're promoting the benefits. We're not selling this as a vegan class or anything like that. They just happen to learn. They're sold on the benefits of it, and they come and then they realize, this is how you have to do it. And, so we're sort of, we realize that marketing is kind of important. And so we're marketing this really, the health benefits of it, not so much marketing it as a vegan program or a plant-based program, although they end up getting that message very quickly. So anyway.
That's terrific. And so you're a full-time physician. Are your patients receptive? I mean, how do you deal with the patients who, like, you feel them out, like they want to do it, they don't want to do it? How does that go?
To be honest with you, and I'm not trying to be funny, I think deep inside, everybody wants this. Who doesn't want to be able to eat as much as you want without portion control, without measuring anything, and eating until you're full, eating delicious food, which of course this way of eating is delicious. And some people just don't realize it, but they'll eventually come to realize if they're shown. And yet you're eating as much as you want, and you're losing weight without, and exercise is important, but even people who can't exercise very much will still lose a lot of weight and reverse all your diseases and feel better. I mean, who doesn't want that? So I think everybody wants it. The question is where are they stuck? That's the question. And so, so the thing is I don't really sell this. I don't say to my patients, hey, how'd you like to try a plant-based diet? Or how'd you like to try a vegan diet? That's not how I bring it up. I meet them where they're at. And so a lot of patients are frustrated with their weight. A lot of patients are frustrated with their diseases or how they feel, or they're worried about their health. They're worried about heart disease. I saw a patient yesterday who was worried his dad died at the same age he was of a heart attack. And so we talked about that. So there's a lot of starting points, for which this conversation can sort of branch off. But ultimately, all roads will lead towards this way of eating, this way of living. And so I find, again, there's an art form to the conversation. I think you guys have probably realized that with your friends and family and with clients too, with patients. And so I'm learning that. That's one thing you don't learn necessarily in the books that you read about plant-based nutrition, is the art form of this. But so it's a work in progress.
Absolutely. Well, I mean, I admire the fact that you're doing this, in a large hospital setting like Kaiser Permanente. I mean, that's huge. There, as much as there's a need for it, a lot of the times, the larger the organization, the harder it is to actually get a new program involved, especially when it deals with nutrition that's a little bit outside of the medication realm. So my hat's off to you for even attempting it in the first place. And actually it looks like it's quite successful so far.
Thanks. No, it definitely is. And I've been fortunate to have some support of some of my local leadership. A lot of them actually are becoming plant-based themselves, and it's very exciting. And the thing is, the results speak for themselves. If you can prove that this works, it's just too hard to ignore. It's just too hard to ignore. And,
absolutely.
Go ahead.
When we were talking with Dr. Ron Weiss, he had mentioned that he he knows about some awesome transformations that you have helped facilitate. So can you go into a little bit of detail here about some of the transformations that you've seen? Let's start with diabetes, and then maybe you can branch off to do something like hypertension or high cholesterol.
Sure. Well, they all kind of blend together, but well, first of all, and I think anyone who's listening to all the lectures in this summit, I think I have a feeling that all these the speakers you have are amazing. So you're going to probably hear a lot of other amazing stories, and maybe some of you have heard some of these. But first of all, the power of this with diabetes, and you guys are experts on this, of course, but I had a patient who for 20 years was on over 200 units of insulin, type 2 diabetes. And literally in 3 weeks, he's off all the insulin. And so that is just mind-blowing. And the thing is, a lot of people say, well, it's got to be just the weight. He must have lost so much weight. But this is 3 weeks. And he only lost 5 pounds in 3 weeks, which I mean is good. But the point is, it wasn't the weight. But the other thing is that this patient, had across-the-board benefits. He was on multiple medications for so many other conditions like high blood pressure, and he had a lot of chronic pain. He had swelling in his legs, and even depression. And all these things got better. He was able to get off virtually all of his medications. I don't remember the exact total of medications he was on before and after, but so that just goes to show that just the power of it. 200 units of insulin gone in 3 weeks. But then there's another patient who had a similar story, but actually reversed her neuropathy. And neuropathy is something that we are told that this is irreversible. That doctors are taught this, and this particular patient couldn't tell that the floor in her house was cold because her feet were always hot and burning. And literally within a few weeks, the sensation in her feet returned. I mean, and again, this is just something that is this incredible. Now, the thing with this patient is that I mentioned earlier that the benefits to this are contagious. This particular patient, not only was she able to get her diabetes under control as well. I mean, her neuropathy went away, but her diabetes also came under control. But her daughter, who we had never met, in other words, the patient was coming to our group, the Life 180 group, but the daughter we've never met. The daughter was on an insulin pump for type 2 diabetes, a pump, and got off the pump because of what her mother was doing. So again, I mean, what medical treatment has benefits like that, where family members are cured, or I don't know if cure is the right word here, but are reversed or treated from their own, the benefits are contagious. So anyway, there's a little more to that story as well, but there's two big stories that I really want to share, which is that we had one patient, type 1 diabetes, who had all the complications in the book: neuropathy, erectile dysfunction, peripheral vascular disease. And he was getting ulcers in his feet. And I mean, chronic ulcers in his feet. One was healing, another one was starting. And there was one that occurred about a year and a half ago. And it was so big, it was 10 centimeters. It took up the majority of his foot. IV antibiotics. He was told that he was going to unfortunately need to have his leg amputated below the knee. And this is actually what my father had to have done. And he was desperate. Who wouldn't be desperate in that situation? And he asked his foot doctor, Dr. Marshall, Natasha Marshall, is there anything else we can do to save my leg? Of course, I really don't want to lose my leg. And Dr. Marshall happened to work next door to Maureen Woodson, who is the nurse practitioner who works with me on Life 180. And so Dr. Marshall had been hearing a lot about the benefits of a plant-based diet and said, you know what, this patient has nothing he's already going to lose his leg. So why not recommend this to him? And so she recommended to the patient, why not try this diet, this way of eating it? We've had success with other patients, and not necessarily in your situation, but you've got nothing to lose. You're already going to lose your leg. And so the patient was so desperate, he said, I'll do it. And he met with Maureen Woodson one-on-one, followed everything she said to do to a T. And I kid you not, that wound started healing so rapidly, so cleanly, that Dr. Marshall said she's never seen a diabetic foot wound heal that well before. And so much so that now actually she and her colleagues in podiatry are recommending a plant-based diet to every patient with a diabetic foot wound, because the way that this particular patient's foot healed. And we're seeing results with everyone else. But long story short, this patient's foot wound healed completely. He saved his leg just because he changed his diet to a plant-based diet. And on top of that, again, the benefits of this way of eating are across the board. So in this case, he not only saved his leg, but his neuropathy also went away. He was actually on painkillers, strong opiate painkillers, which that's a whole other conversation altogether, but that's a concern. He was able to get off the painkillers, 90% of the pain went away, and his erectile dysfunction went away as well. So this was a man who was going to lose his leg, be probably dependent on painkillers for the rest of his life, and have a very poor quality of life, with erectile dysfunction, and so this man now has none of those problems. He is walking, he's got, virtually no pain, and he's got, good quality of life, no erectile dysfunction. I mean, talk about life 180, talk about 180-degree transformation. So like I said earlier, the podiatrist started recommending this way of eating to all their diabetic foot ulcer patients. And we're seeing amazing healing with these other patients too. One of those patients came to us, type 2 diabetes. She had just had 2 toes amputated and was at risk of losing her leg as well. And she had been on insulin for 15 years, 4 shots a day. She's type 2, but kind of a severe case. She has a history of heart disease. She had a bypass surgery, coronary artery bypass, and she was on dialysis. And long story short, her foot healed beautifully, which was not a shock after seeing what happened with the other patient. And she was able to get off all of her insulin, 100%. And many of her medications she was able to get off. I think she was on 16, and I think she's on like maybe 1 or 2 right now. And blood pressure went down. She lost 60 pounds. But here's the thing which blows all of our minds away. We've never seen this before. She was on dialysis, and her kidney doctor, nephrologist, was noticing that in between dialysis treatments, ever since she'd become plant-based, she wasn't retaining as much water, she wasn't gaining as much weight, and her labs were looking better and better. So he thought, you know what, maybe we can slow down this dialysis. Maybe instead of 3 days a week, we could do 2 days a week. And sure enough, he tried that with her, and lo and behold, her kidneys were holding strong, and she was doing great. She was continuing to not put on water weight and or not retain water and put on weight. And he went, okay, well, he said, well, look, 2 days a week is going well. Let's try 1 day a week. And long story short, little by little, she was able to get off dialysis completely, 100%. So this was a patient who, could have lost her leg, was going to be on insulin the rest of her life, was at risk of, further heart disease, was on dialysis, was miserable. She literally came to us in a wheelchair, miserable, couldn't really walk. And I kid you not, she ended up recently going on a cruise vacation, dancing on the cruise, partying, having a great time. She is so happy. If you see her, I mean, she's got the biggest smile on her face you've ever seen. She hugs everybody. She occasionally will cry tears of joy. And, I've never seen transformations like this. There's no pill, there's no vitamin, there's no shot. There's no surgery that can do this for people. And as a physician, as a doctor, I mean, it's the most rewarding thing. These experiences with these patients is the most rewarding thing ever. I mean, this is becoming where, this is not work anymore. I mean, being a doctor has never really been work, but this is something that has brought so much joy to me. And to be honest with you, in medicine nowadays, I mean, there's a lot of unhappy physicians, and seeing transformations like this, I mean, I get up. It's a big reason to get up every morning and smile myself and look forward to helping other patients go through this, because you just never know with a plant-based diet what's going to happen, and the surprises are just incredible, and the patients are so happy, and it's I don't know, it's just brought so much joy and satisfaction to me that I can't. I guess I can't contain my my passion. So Anyway, I mean, there are other stories, but I think those two right there, I mean, there aren't too many stories much better than that. Anyway, but yeah, I've seen patients, like I saw yesterday in my clinic, actually, a patient who was having angina, and he had had a heart attack about 1.5 years ago, and he could not walk across a parking lot without having chest pain. And went on a plant-based diet, and the chest pain is gone, and no more chest pain. And his cardiologist is amazed, and so, you know, and he's just absolutely beside himself. I mean, who wouldn't be? I mean, to feel like he felt he was trapped. I mean, the thing is, a lot of people, and myself included, when you've got a disease and you've got a problem that you feel like you don't have control over, you just feel trapped. And myself and a lot of my patients, they now feel free. This is freedom, and freedom from disease, freedom from having to worry so much, and freedom from feeling sick, freedom from medications. This is absolute freedom, and yeah. Anyway, so
you said earlier how, you know, you're like obsessed with this. I mean, and
I am.
We feel the same way. I mean, with these kinds of results, it's just it's incredible, and it's so simple. What we're doing here is so simple. So why don't you go ahead and give us some practical tips? You're obviously really good at helping your patients execute this to get these results. So how can people implement this in their own life?
Absolutely. So I think the first thing is to know why you're committed. And because some people don't really know how committed they are or know why they're committed, and they just feel, well, I'll try this, but really knowing your why and your emotional reason, and reminding yourself of that, because honestly, the first few weeks are kind of tough, and it really helps to really know your reason for doing this. And sometimes your reason is your family or your their emotional reasons for doing this. But nonetheless, so know why you're doing this, and then make a priority your health. Because in other words, most people eat for pleasure first and health second. I'd say pleasure and convenience first and health second. You have to flip that around. It has to be health first now and pleasure and convenience second. Now, that being said, probably the most important thing is controlling your environment. What do I mean by that is essentially getting rid of all the junk out of your house. And because the thing is, if it's in your house, it's in your mouth. Actually, I learned that quote from Chef AJ, a plant-based chef, and it's really true. I mean, we're programmed. I don't know if you guys have read the book, The Pleasure Trap by Drs. Goldhammer and Lyle. It's an excellent book. And if you read that book, you realize that we're programmed to seek the richest calorie foods in our environment. And we're programmed that way for survival. And it makes sense. I mean, you know, when we were living in nature, we had to avoid starvation. And so it would actually be beneficial for us to eat as many calories as possible. So that's just the way we are. It's not that we have weak willpower. It's not that we're weak. It's, if anything, we're strong. We're built for survival. And so the thing is, if you understand that and you respect it, then you realize you've got to clean out your house. And so by doing that, if you clean out your house, and then of course you got to stock it with healthy food, because a lot of people clean out their kitchen, but then they don't plan, and they don't stock their house well, and then all of a sudden they're tempted to go out to eat. And so you don't want to fall into that trap. And when I talk with patients about stocking their house, it's not only or home, it's not only stocking with items that you're going to cook gourmet meals, but it's stocking and planning for quick, easy meals as well. And so I recommend a combination of you kind of have to plan for every situation possible. So it'd be nice to make a gourmet meal every single day, but that's not reality for most patients. So I do recommend batch cooking, and so once or twice a week, maybe making a big pot of something or two. That helps a lot, and then you put away a lot of these things in the freezer and so forth. So your freezer can be stocked with items that are just ready to go. But at the same time, there's got to be you got to have some quick, even if you don't have time to batch cook, just quick things. Like, it just depends on on the person. But, salad and fruit is so quick and easy. And so that should just be always there, always ready to go. And when you're new to this, having a good dressing or two, you got to experiment. And that's part of this is if you're really committed, part of being committed is experimenting. Because if you try something and it doesn't work for you, don't give up and just stay committed to it. And it helps to know your why as well, because if you're not really strongly committed, it's easier to sort of say, well, I didn't like what I ate today. I'm just going to go back to what I was eating before. But then the other thing too that's really important, and a lot of books will talk about this, and especially the pleasure trap, is that the first month or so is pretty tough for a lot of people, because you don't realize you're kind of addicted to a lot of the processed foods and the animal foods as well. And so it's normal for people to get cravings during the first month. I had a lot of cravings the first month. I had a tough time with that. However, what really helped, a couple things, is that number one, keep eating. When I say keep eating, I mean don't go hungry, because if you get to eat as much as you want with this, which is great. So allow yourself to do that. Don't fall into that old trap of portion control, because if you restrict the amount of food you're eating and then all of a sudden you're hungry, your cravings are going to be even stronger. But then the other thing too is that usually the first month or so, the benefits are so incredible. I lost in the first month 17 pounds. How could I ignore that? And so I said to myself, look, this is going so well. Yes, I have cravings, but I've heard that these cravings will subside, and they do. They really do. For some people it's a month, other people it's 2 months. It just depends. It depends on the food. So you clean out your kitchen, you stock your house, your home, you experiment, you have you maybe do some batch cooking, you have some quick things, and I personally do have some soups that are in a box, and soups are in a box because if I literally have no time at all to make anything, or let's say I'm just having a very tough day and I'm exhausted, okay, I can open up a package of soup that's already made. And, I don't do that all the time, but it's just nice to have something for a rainy day, something for, when you're super busy. And, we can go on and on about tips, but I think if you only have access to healthy food, you will succeed. So if you lock yourself up in your home and you only have healthy food, you will succeed. In other words, you don't really need any tips at that point. I think where most people struggle, honestly, is their environment. And when I say their environment, they're allowing things in their house. They're fooling themselves into thinking that moderation is going to work for them. And I'll be honest, moderation for addictions, it doesn't work. And I think you have to be honest with yourself and realize that for a lot of these foods, there is an addictive component. And so admitting to yourselves that, moderation isn't going to work for the cookies, crackers, chips, things like that. And for some people, bread, and some people, tortillas, and it just depends. You have to kind of know what your triggers are and know which foods are going to lead you down that trap. So anyway, so those are some of my tips. It's just more of like mastering your environment, I'd say. And some of that is family too. So learning how to deal with family and friends, that's a whole other topic altogether, but that's important.
This is actually really, really helpful because, I've heard from a lot of people that, they have a difficult time transitioning to a low-fat, plant-based whole food diet, or just a plant-based diet in the first place. And then just like you're saying, you go look in the fridge, you look in the cupboards, and all of a sudden it's stocked with a bunch of refined, packaged, and processed foods. I've seen that personally. That happens in my family. And, I've actually seen kids, as an example, they'll you provide them with a really healthy meal, and, they'll eat it, and they're sort of like, okay, great, have some potatoes, whatnot. And then as soon as the meal's done, they go straight to the cupboards, they open up the cupboards, and they're just looking. I see the look on their faces sometimes where they're just looking at this wall of like packages and cookies and crackers. And it's like, you see the excitement, and it's like, wow, it's like, if you're not mastering your environment, then you can't expect that you're going to master a new lifestyle, right? You got to set yourself up for success. So I fully agree with what you're saying. And I think it's actually not only just a helpful tip, but it's actually like, it's required to get to a point where you feel fully autonomous.
Exactly. Exactly. I realize too that there are situations they're going to come up that you're not expecting. And sometimes you learn the hard way. I'll share a quick story. We have two small girls, and we oftentimes go to kids' birthday parties. That's what parents do with small kids. And kids' birthday parties, unfortunately, are notorious for terrible food. And when I was first starting this, I think it was within the first year or so, I made a big mistake, and I went to a kid's birthday party completely hungry. It's totally starving. And I had a weak moment. I ate some food there that I shouldn't have. And I realized, a couple things. Number one is that you can't always anticipate every possible situation. But on the other hand, for success with this lifestyle, especially in today's society, you really have to plan ahead and have sort of a strategy for sort of all the different scenarios that come up. And I realize that's a little bit of extra work, homework, I guess, but it's so worth it, of course. And so what I did is that after I ate this food that I regretted eating, I learned from my mistake, and I realized that the next time I go to a kid's birthday party, I'm going to eat before I go. And it's a simple thing to do. Eat before you go. You're full. You're not tempted. And it's something that it's so simple, yet a lot of patients or people don't realize that that's not only acceptable, but it's just a very useful strategy. And I find that a lot of people just kind of slip up here and there. And when they slip up here and there, it's a slippery slope. And so I think part of the plan for success is to kind of plan for all the various scenarios that could come up. And again, I realize that it's unfortunate that that's the way our society is, that there's so many ways in which our society can trip us up. But that being said, if you're really committed to this, you not only master your environment at home, but you master your environment, your social environment, your friends, your family, all the various situations that could come up. And I found that it gets easier and easier. But you can't be passive about this. You kind of have to be, because if you're passive, you just sort of let your friends, your friends might say, "Oh, just have one of these. It's okay. Just try one cookie. Just have one, whatever it is, and one French fry." And I know that that's tough for people, but that can be a problem. Some people are people pleasers, and it's tough to have to now put yourself as the priority and not your friends or family. In a way, I don't think it's selfish. I think it's a matter of just survival and health, and eventually you can become a role model to your friends and family too. And so rather than sort of give in to them, I mean, if your friends were doing drugs or smoking cigarettes, you wouldn't give in to them if they said, I mean, that there's a stigma attached, of course, but not so much with the foods we eat these days. But that's what we have to do. We have to be examples. There's not enough of people eating this way, but we have to be strong and be examples for others in order for our society to eventually come around and change.
Absolutely. We love your story. I personally love the fact that you're doing so much of this work, like we said, at Kaiser Permanente, and you're actually trying to bring it to like a more mainstream, medical institution. So keep up the good work. Keep working hard. Clearly, you see the benefit for yourself. You see it for your patients. Now you're broadening it to not your own direct patients, but just patients who come to Kaiser. And thank you so much for your time, for being here today. You're a true inspiration, and we really appreciate you taking the time to do this.
Thank you both so much. It's been an absolute pleasure, and I'm so inspired by the work you both are doing, and keep up the great work yourselves.